Hi, my name is Robert Hasserjian. I'm a pathologist at Massachusetts General Hospital in Boston, Massachusetts, and I'm going to tell you today a little bit about what I do as a pathologist. A pathologist is a doctor. I have an MD, so I went to medical school, and pathologists don't see patients. We actually work behind the scenes to diagnose diseases and help the doctors that patients see that actually treat their diseases. So what I do is I look at slides, I look at cells, I look at different types of tissues that patients may have had biopsied or blood samples, and I tell other doctors what disease the patient may have, and I give them advice about how to treat that. I think it's a very exciting area of work, and I think it's that I got when I got my medical degree. I was really happy to go into pathology because I feel I can help many people in all the slides that I see in one day, and that really gives me a lot of gratification. So this is my office. I work at a computer a lot because I give reports that gives my diagnosis. And you can see I eat in my office, I store slides, I want to be comfortable in my office and what I do. But the big main instrument I work with is my microscope, and this is my microscope here. This is an important instrument because this is what we use to look at the tissues that are taken from the patient, the blood smears, in order to tell the doctors what the disease is. So I spend a lot of time sitting here looking through these binoculars, basically looking at the cells to help me decide what disease the patient has. So this is what I'm going to show you a little bit about how to use a microscope, and I spend a lot of my time at the microscope. So a little bit about what I do. So I just want to first start by showing you what I work with. This is right here a slide. This is actually a blood smear. It's taken from a patient who has some symptoms. The patient has anemia, so the patient feels tired because they don't have enough cells in their blood, so they feel tired. And the clinician, the doctor who saw the patient took a sample of the blood. We made a slide from that sample, and now I'm going to look at it under the microscope to see why the patient has anemia, why they feel tired, if we can find some reason, and then help that patient to find the cure for that. So here's the slide. I'm going to look at it now under the microscope. So I'm looking at it now, and I'm seeing the cells through the field. And you can actually look through as well there if you want. If you put it right up against the camera, right up against the eyepiece, you should be able to see. Put it right up there. All the way. Let me try to do it. So I'm looking now at a blood smear, and this shows the cells that are on the smear that are abnormal. And these abnormalities the patient has too many white cells in the blood. So this patient has a type of leukemia, and that's what I've been able to tell by looking at these slides. So from looking at this slide, I now can tell the patient's doctor that they have a type of leukemia. We also do other types of studies. We do studies to look at the types of proteins that are on the cells. That tells us what type of leukemia the patient has, because different leukemias are treated by different types of drugs. And it all starts by my looking through the microscope at seeing what the cells are, and that starts the whole process of learning about the disease that the patient has. That way we can give the patient the right drugs to treat the disease. So when I make a diagnosis and I figure out what type of, say, leukemia the patient has, it's very satisfying because I know I've helped that patient, even though I never meet these patients. The only part of the patient I see is this, which is the slide made from the patient's blood. So it's strange for me because I don't actually meet the person. I don't get to talk to the person, but I know that I'm really helping the person, which is a type of gratification. So I'll show you another type of sample that we do. These are slides from bone marrow, a bone marrow sample that's been taken from a patient that has a type of leukemia. And I look at these bone marrow samples, a biopsy that's taken, and I figure out what type of leukemia the patient has. Again, blood sample can be taken or a bone marrow sample. So again, once again, leukemia is a very complicated disease, and we need to do a lot of special tests on them. So it takes a lot of time to figure this out, sometimes several days. We do a lot of different studies. We look at the genetics, we look at the DNA, the chromosomes to figure out what it is. So I'm doing many different things, not only looking in the microscope. But in the end, again, we give a specific diagnosis, which is really helpful. So in talking to you, if you're thinking about becoming a doctor, of course, that's a very exciting field. And when you think about what a doctor does, you might imagine all they do is see patients, talk to patients, and that's what most doctors do. But the type of doctor that I am is a different type of doctor, again, working behind the scenes to diagnose diseases and by looking at these slides. And the thing I enjoy about it is being able to help the patients in that way. And also it's very visual. By looking at slides, I see the colors are interesting. People who like art often say they like pathology because it's very visual. It's like recognizing patterns. It's putting things together. It's like putting a puzzle together to figure out what the patient has. It's solving a mystery. And that I think also is very exciting to people who do pathology. So I hope in these few minutes you've learned a little bit about my field, and I hope it's something that you might consider and in the future as a very good and satisfying field and a way to help many, many people in medicine.